Well, thank you very much for coming today to the group. We're going to kind of work today, forward our work on smoking cessation. And what I wanted you to think about is think about a change that you were able to make in the past. What were some of the benefits that you experienced from making that change?
Well, since I've quit drinking, I've lost 20 pounds, which I'm really proud of. And I also noticed that I don't argue with my family as much anymore about the stupid things that I used to do when I was drunk.
Uh-huh.
So that's a plus.
That's great. No, so you've lost some weight, which you're really happy about, and you're getting along better with your family since you quit drinking. So what about some others? What are some of the other kind of things, benefits?
Well, I just quit using, and it hasn't been easy, but I'm actually sticking with it this time, and I think that's definitely a benefit.
Congrats, that's great. As for me, and believe it or not, I've actually quit smoking before. That was years ago, but I saw some benefits in that.
Mm-hmm. So what kind of benefits, John? Can you tell us a little more about that?
Well, it made breathing easier. I've got an active job, and so it made working easier. Just walking. It made going upstairs, up hills. It made playing with my kids easier. My wife worries about me, about my health, and so that's nice when I'd quit. And she says that when I'm smoking, that kissing me is kind of like licking an ashtray. So
great. Well, thanks, John. I appreciate you sharing all of that. So most of you, if not all of you, have experienced some changes in the past that have helped you and kind of you feel good about. And you've experienced some benefits in terms of some of the physical health, family, spouse kinds of stuff, in terms of fighting with them, confidence in your ability to kind of overcome addictions. So we've heard from John some of the benefits that he experienced the last time he quit smoking. I wonder if some of you could talk a little bit about the benefits, what other potential benefits might come from quitting smoking. What do you think?
Oh yeah, saving money is also a benefit. Cigarettes are a lot more expensive than they used to be.
I'll agree with that one.
Yeah.
And one of the things that I'm hoping, when I smoke, I want to drink. Since I've quit drinking, I don't want that to interfere. So hopefully when I quit, I won't have the trigger to reach for alcohol.
That's a good point. That's a good point. So it's important for you to staying off alcohol, and quitting smoking will really help you do that.
Exactly.
That's great. That's great. What are others of you think of benefits about quitting smoking?
Well, if smoking is a trigger for drinking, and you definitely want to quit drinking, then definitely quitting smoking is a benefit. I actually, until you said that, that's the same as me. And I hadn't realized it, but that's definitely a benefit as well.
So in addition to some health benefits, the breathing easier, the quitting smoking and supporting abstinence from drinking, what else? Are there other things? Andrea, Kate, Alex, anybody kind of think of other things that would be helpful?
Yeah, well, it's a no-brainer that if you quit smoking, you're going to lower your chances of getting cancer in the future. So that's definitely a benefit. It's just that for me personally, right now, I'm just afraid that if I quit, I'm going to get so stressed out and depressed. I'll probably start overeating and gain weight, and I might even start using again. And I just don't know if I can handle that right now, and I really don't need another depression episode.
Right. No, I agree with you. And so it sounds like it's really, on the one hand, you're kind of really worried about the stress and the depression and the possibility it can trigger some relapse or other kinds of negative things, weight gain, other things for you.
Right.
But on the other hand, it sounds like you have still some reasons or some things that might be helpful if you could quit smoking.
Well, yeah, I'm just worried about the stress and the depression and the weight gain. But listen, I know I need to quit smoking. My doctor's after me all the time because I have a family history. My mom's in the hospital right now with stage 4 lung cancer.
I'm so sorry.
Thanks.
Kate, I am so sorry to hear that. Well, you have to quit smoking if you have a family history. And try exercising. I understand that that's going to help reduce the stress and the weight gain. That's what I plan on doing when I quit smoking.
Sarah, I think that was really helpful in terms of your concern for Kate and for her not getting in the place where her mother is now with cancer. But I wonder, sometimes if we tell people what to do, they don't really respond very well. So I wonder if you could kind of reframe that and rephrase what you said and ask her permission if you could make some suggestions. That might go over a little bit better.
I don't mean to tell anyone what they should or should not do. So, Kate, may I make a suggestion?
Go for it.
Well, someone told me that exercising does help reduce stress and help with the weight gain.
Great. Thank you, Sarah. That's helpful, and maybe that will help her to kind of think about that a little more. So, Kate, what do you make of that suggestion?
Well, I'm willing to give it a try. You know, if exercise will prevent the weight gain and, you know, help with the stress and depression, and I know I need to quit, so I'm willing to give it a try.
So obviously exercising then becomes one of the tools that you have in your toolbox. So what are other tools that could help you support quitting?
Well, my meds, you know, they make me cloudy and they just make it hard to focus. And when I've quit smoking before, I really struggle with being able to focus because, you know, quite honestly, smoking helps you focus. So a tool, I don't know if it's a good tool, but a tool I've used in the past is caffeine, you know, coffee, just to help me focus and get through.
Yeah. So having some caffeine would be one tool that you could have to help you in the difficulties with kind of focusing. What other tools might be helpful in support quitting?
I think gum or some sort of candy would be a good replacement.
Yeah. One tool I've been thinking a lot more about lately is using Chantix, that one medication that's supposed to help you quit smoking. I'm not sure about using it, but I'm thinking about it.
That's great.
Yeah.
No, I think about medication can be helpful, and people should kind of consider those. That's great. So that's excellent. All of you have kind of thought about some of the benefits and the potential benefits for quitting smoking for each of you, and I think it's really important that it's your own personal benefits. And then you've thought about some of the tools that are around that you can think about using when you kind of come across some of the barriers or the challenges that you meet when you're trying to quit smoking. So that's great. What I'd like to do now is see if we can kind of move to looking at how we can incorporate those tools into a change plan that each of you could make for yourselves. So we could go on and look at the change plan worksheet that we have on page 12 in your workbooks.